All right, guys, hey, here we go. I'm live. This is probably, of all the live videos I've done, the most important one I've ever done, okay? I know I've been talking to you guys a lot here the last several months about building the host through supplements and all this other kind of stuff and how to deal with Corona and COVID and everything, but at the same time this morning, I just released another article or made a post explaining how in this quote-unquote second wave that's supposedly coming through that they've already done research on back in February in Europe, and it's showing extreme neurological issues as a potential long-term effect, particularly things like Parkinson's. Okay, so that's why I said this morning in the post I made earlier, that is the importance of taking care of your nervous system. Okay, you have to take care of your nervous system. That is what controls and coordinates every single function in your body. Everything. If someone's at the hospital and they've got a problem with their heart, their lungs, all this other kind of stuff, they can put them on vents, put them on different machines, keep them breathing, keep them alive. But if you're brain dead, that's it. So you have to be able to take control and take care of your body specifically through your nerve system, okay? Because that's what controls and coordinates everything. So I put on the post this morning, how healthy is your nerve system? If you just think it's healthy because you feel pretty good or you make it through the day, you're terribly deceived, okay? That doesn't mean that your nerve system is healthy. That's like going to a dentist and a dentist telling you that you've got to have good dental hygiene and you thinking that you just have it because, you don't eat a lot of sugar or, you swish your mouth out after every meal or something like that, but you never brush your teeth. Well, if you're not brushing your teeth and flossing and doing the things that they advise you to do, there's no way you're going to have good teeth. And so the same is true about your nerve system. There's no way your nerve system is as optimal and as healthy as it can possibly be if you're not proactively taking care of it. Guess what? Getting a massage is not taking care of your nervous system. Now, I'm not saying anything's wrong with getting a massage, but it's not taking care of your nervous system. Exercise is not taking care of your nervous system, okay? That is your muscles and may help improve a little bit of cardio function if you do specific exercises. So I just don't want you guys to think that if you exercise and you eat fairly decent and you may get 6 hours of sleep every night and all these other little things, you drink your 8-ounce glasses of water every day, that you're proactively taking care of your nervous system, because you're not, okay? There's no sense in us sitting here jerking each other's chain today. You've got to actually do something about your nerve system. So you may be looking at this video right now and think, well, what have I got to do? What are you talking about? Well, as a chiropractor, we analyze your spine because that's what houses your nervous system. Look, there's two things the good Lord put in your body and He thought was so important that He totally encased it with bone. Here's one of them right here, your brain. Okay? He totally encased your brain with bone. It's called your skull. The other part is your brain stem and your spinal cord, and He put that inside of your vertebrae. That's your vertebral column. Those two things are so important. Only two organs in the entire body that are totally encased with bone. Your heart's not, your liver's not, your stomach's not, your lungs are not. Nothing else is totally encased with bone. So that's pretty important. And so I said all that to say this. The only reason as chiropractors that we even touch your spine, or particularly your back or your neck, is to make sure that all 24 vertebrae are properly adjusted, that there's no subluxations, those are misalignments in your spine, that can affect your nerve flow and decrease potential nerve flow. And so whatever that nerve's connected to, whatever cell, organ, or tissue that nerve's connected to, can then experience dysfunction in the body or dis-ease, which just means it's out of balance. There's no homeostasis. And so adjusting your spine and freeing up the interference caused by those misalignments and those subluxations ensures that your nervous system can optimally flow and operate the way it was designed to. Okay? And so I'm going to show you the process that we do here in my office. Other chiropractors may do other things, and that's perfectly fine. That's what they feel comfortable with. But here in our office, we use some amazing technology. We use thermographic imaging, we use surface electromyography, and we use heart rate variability to get a complete assessment of your nervous system, your sensory nerves, your motor nerves, your autonomic nerves. We look at everything. I try my best not to leave any stone unturned, okay? Because I treat every single patient of mine just like I would if you were family. So if you were my mother, my father, brother, sister, wife, aunt, uncle, niece, nephew, children, I'm going to treat you the exact same way as if you were blood related to me and walked in the door. And this is how I treat my folks, okay? So we're going to do this scan here today. I've got Kelly here. She's our assistant. We're going to be doing the 3 scans on her. And I've kind of put her on the spot because Kelly's never been scanned. She's new with us, just starting out. But guess what? One of my requirements is you work for me, you get scanned, and you get adjusted, okay? Because I want the absolute best employee I can possibly have. I want to surround myself with folks who are functioning at the highest level, okay? And so this just helps ensure that. So we're going to do the scan on Kelly. And as I do the scan, I may talk about it a little bit and say some more things about it. But let's go ahead and get started. And so the first one that I'm going to do is called a rolling thermal scan. Like I said, it uses thermographic imaging. We're going to be measuring the heat on each side of Kelly's spine because one of the core functions of your nervous system is to regulate your body temperature. Okay? That's the basic functions of your nervous system, one of them. And so if I'm doing this scan on Kelly and I'm rolling this little device, this thermographic imaging device, up her spine, and there's a difference in heat on one side of the spine compared to the other, just 1.5 inches apart at the same vertebral level, then we know we have a problem. There's a dysfunction in those nerves at that level. And that dysfunction most likely comes from a subluxation or a misalignment. And so that's what we're going to be looking for on this first scan right here with Kelly. All right, so here we go.
Begin scan, S1.
We start all the way down at the bottom
L1.
at S1, which is your sacrum.
T1.
We come up to L1. Then we come all the way up to T1.
C2.
And then we go all the way up to the base of your skull.
Left C1.
And now we're doing the very, very top
Right C1.
on both sides. Okay? And so there we have it. So that's the first scan. And like I said, that scan is going to show us if there's an aberrance or a difference in temperature on either side of her spine at any level. And if we do find those areas and we can associate the probability of a subluxation at that level, well, then we know from an organ standpoint of view what those nerves go to. And I mean, almost 100% of the time, when people come in and get scanned and I see issues on the scan, they have those things going on already in their body. A lot of times patients don't tell me about them because they don't associate acid reflux with chiropractic. Well, if you've got a lot of problems at T5, T6, at the areas in your body that control your stomach and how much acid or how whether it's too much or too little, then you can have issues with your stomach, and acid reflux is just one of those issues. And so by making sure that we clear the pressure out at that level, by adjusting the spine and optimizing the nerve flow, most people's acid reflux resolves on its own. No, listen, nobody has acid reflux, nobody has headaches, nobody has asthma or anything else from a lack of medication in their body. And so when that's your only solution or your only fix is for a symptom to arise and you start just adding drugs, medications, that to me, that just makes no sense. Okay, now I'm not kicking off on anybody else. Just from my chiropractic mindset, that makes no sense unless you try to find out what's first causing the issues or causing the symptoms. Okay, and all I'm saying is, rarely ever is it because you have a lack of Tylenol in your body, or you have a lack of Pepsid AC in your body, or a lack of Claritin, or albuterol, or any of these other drugs and medications that we so quickly go and get prescribed to us and start taking. So, all right. Now, next scan we're going to do is the surface electromyography. So we just looked at Kelly's sensory nerves through her brainstem, spinal cord, and so now we're going to assess the muscle function. Now, you have 3 curves in your spine right here. You've got a lordotic curve in your low back, a kyphotic curve in your thoracic spine and your mid back, and then another lordotic curve called a cervical lordosis in your neck, okay? Now, the good Lord put these 3 curves in your spine for a very specific reason, and that's for stability and support, okay, and strength. Now, the same reason we have these curves naturally in our spine is the same reason the Hoover Dam is curved, okay? Much stronger, more stability, more support, and the thing about it is, as long as we try to maintain these curves as much as possible, then we optimize the idea that our spine is going to be as stable, as strong, and supported as well as it possibly can be throughout the course of our lifetime. Now, I know there's things like scoliosis and stuff like that. Those are lateral deviations in the spine. We're more looking here at the potential of having a loss of any of these 3 curves from a posterior to anterior angle or from a front to rear concept, okay? So now we're going to do the muscle scan. It looks much like the first scan that we did. We're going to start at the very bottom and just go segment by segment all the way up until we get to the very top. And as you can see, the first test, Kelly's totally fine. Okay, she didn't die. None of this hurts. It's totally non-invasive.
S1.
And so we're going to look now at the muscles.
L5.
And one of the cool things about this is the computer just walks us right through it. We just have to make the contact.
L1.
And it does all the assessment for us.
T12.
You know, it's kind of like going to your doctor and, you know, having blood work or having an x-ray or anything like that.
T10.
These are non-invasive passive tests. Well, blood work's kind of invasive. You have to
T8.
puncture the skin through the, you know, vein or artery to draw some blood, but
T6. T4. T2. T1.
well, I said this is an awesome
Left.
and simple little
C7.
test, but gives us a lot of information about what may potentially be going on
Right.
with
C7.
someone's health and someone's spine.
Left. C5. Right. C5.
Yay, we got 2 more to go.
Left. C3. Right. C3.
And last one.
Left. C1. Right. C1.
All right, we're going to kind of fasten Kelly back up here with a gown. And now I'm going to give her a seat over here in the chair. The last test we're going to do is called a heart rate variability exam. Okay, have a seat in the chair for me. And I've talked to you guys a little bit about that before on different videos and the importance of heart rate variability and the different folks that use it. You know, most all the major teaching hospitals, Cleveland Clinic, Mayo, and all like that. Neurologists in general get a lot of information from heart rate variability. And so when we do this exam, we just got through looking at the sensory and the motor nerves. The motor nerves are the nerves that controls the muscles and reflexes. And so it's the same nerves that controls the muscles on each side of the spine that we just measured on Kelly. And so now we're going to look at the autonomic nerves, which is primarily what controls all your organs, glands, and vessels. Okay? So if someone comes into me and it doesn't matter what the symptom is, if they have headaches, chronic headaches, low back pain, neck pain, whatever it may be, number one, we don't treat the pain. Okay? Our job, or at least my job, is to try to find out what's causing the pain and address that, especially if it's related to the spine or nervous system. So we're not necessarily treating the pain, we're trying to find the cause, which is most often that subluxation, the misalignments, and then so we correct those. Now in doing so, especially with the autonomic nervous system, you can literally change the function of organs or organ systems by making adjustments to the spine. And so heart rate variability, we're going to be able to take a real good look at some vagus nerve flow here. The vagus nerve is a very important nerve that helps the brain communicate with the organs and how the organs talk back to the brain. And so we're going to be utilizing heart rate variability to assess the function of that autonomic nervous system and see how connected Kelly is and how well her brain's communicating with her vital organs. And to see if each branch of the autonomic nervous system, you've got parasympathetic and sympathetic, to see if those two branches are as balanced as possible. One's called the brake pedal, that's the parasympathetics. The other's called the gas pedal, which is the sympathetics. So we don't want either one of those to be dominant. Okay, we don't want the brake pedal slammed on, but we don't want the gas wide open either. We want there to be that nice ebb and flow and that nice balance between those two branches. So we're going to look at that as well. So, all right, Kelly, I'm going to have you to stick your hand right here in this device. Your middle finger goes on the gray, your ring finger and index go on the gold. And so just put those right there for us. That's perfect. And just relax your hand. All right. Now, this part of the scan, the first two, a minute, minute and a half or so, this part takes actually 3.5 minutes, okay? And so while Kelly's scan is conducting here, I'll be talking to you a little bit more and explaining some of the things that we so often see when I do these scans, and it's things that concern me. First of all, in terms of your autonomic nervous system, if there's an issue up here in the cervical spine in particular, okay, especially any of the top 3 or 4 segments, C1 and C2, C1 is called your atlas, okay, that's the very top bone in your vertebrae. It looks sort of like if you was to, cut my wrist off here or my arms off at my wrist, the bone looks like that if you're looking at it from the top looking down. And that's what your spinal cord, your brain stem and spinal cord comes right through that big hole at the top. And we call that the foramen magnum. In Latin, that means the mouth of God. And so your spinal cord comes right down through that foramen magnum and goes all the way down to your sacrum, to your lumbar spine actually. And then at the very bottom, it sort of flares out, and that's called cauda equina, or also in Latin, horse's tail, because it looks like a branch of nerves that just branch out. But anything up here in the top, if you've got problems up here, that, I say problems, subluxations, misalignments in your spine that's creating pressure on your brainstem, that pressure, if it's bad enough, can affect the vagus nerve, which comes right off your brainstem, comes down and starts with your heart in terms of the vital organs that it communicates to. And so I can't tell you how many times in the past patients have came in and they're on high blood pressure medication. But they may be, younger. I mean, they may be in their 30s, 40s, or so forth, even in their early 50s or whatever, and, look extremely fit, not have a weight problem, anything like that, but yet they're on blood pressure medication. And so I've asked a lot of people over the years, especially when they're in their 30s and early 40s and already on blood pressure medication, have you been diagnosed with heart disease? Is there any test that they've done or any indication that you have atherosclerosis, arteriosclerosis, hardening of the arteries, congested heart failure, any of that stuff? And almost unequivocally the answer is no. But yet they're on the same blood pressure medications as many of those people who do have all those problems. And so here's the point. Sometimes things as simple, and I say yes, as simple as blood pressure issues, especially asthma in children, but this new seemingly adult onset asthma diagnosis that's going on with a lot of people, even that acid reflux I talked about a moment ago, if there's not a problem along the spine that directly correlates at that level, but there is issues up top with the atlas or the axis and the brain stem, and it can be affecting that vagus nerve flow, that can be the problem with your high blood pressure. Someone can have high blood pressure, not have heart disease, and the whole problem be because there's pressure on the spine at the level that's affecting how the brain's communicating with the heart. There are numerous studies that have shown patients getting adjusted, especially upper cervically, in the upper cervicals here where I'm talking about, and their blood pressure come down. I mean, there's study after study after study showing that. And so that's the mechanism in which that happens right there. So we're going to take a look now and see what we've got with Kelly here. And, okay, finish up and save her scans. All right. Okay. You can pull your hand out of there. Thank you, dear. All right. Kelly, do you mind if we go over your results? And okay. HIPAA and all that stuff. I was making sure I had her consent that the whole world can see her results, and, if you will, some of her healthcare information, and she totally consents to that. So once we do those 3 tests, here's what we do. I go over each individual test with you here in the office. And so on Kelly's, just turn the screen off. Sorry about that, guys. We're going to start out with the first one that we did, okay? And that was the thermographic imaging test. This is the one that's going to show us if and where there's any problems along the spine in terms of the heat being different, which I told you leads us to believe that there could be a subluxation at that level of misalignment in the spine. And so here's what we have with Kelly. We see white all the way from the bottom up to the top until we get to the very top right there at C1, and then we have a blue bar, okay? So the white indicates that things are within normal limits, okay? But if we see green, blue, or red, then that means we have an issue at that level. Now, if it was a green bar, then that means there's a mild amount of pressure residing around that joint capsule. The blue indicates moderate amounts of pressure, and the red would be severe. So the only place along Kelly's entire spine here she's got an issue is right up there at C1, which happens to be one of the 2 most important bones in your entire spine, okay? Because it's up there, as I just stated, right up there next to that vagus nerve. Here's an easy analogy for everybody. Think of your nervous system sort of like a water hose. And I mean, this is so simplistic. I hope it doesn't, offend any of my peers or anything like that if you happen to be watching this video. But your nervous system is much akin to a water hose in the sense that if you tie a hose into the spigot, turn the faucet on, and then you clamp the hose, especially right there at the faucet, there's going to be a reduction of water all the way down the hose. Anybody that's ever used a water hose understands that. If there's a kink in the hose, if you squeeze it or you pressure it, you clamp it at any level, you reduce the normal flow, then that's what happens. You get a reduction of flow from that point down. But also, if you take that water hose and you squeeze it or clamp it or kink it, the hose above it starts to swell, okay? Because of the pressure is still coming, the supply is still coming from the brain, if you will. But if we've got a misalignment, a subluxation, a problem at that level, then below that is somewhat of a decrease in function or flow, and above it, there's a pressure, okay? And so if that pressure happens to reside right here at the very top, that can affect the brain stem and ultimately how well that vagus nerve functions, which is, like I said, has a large role in how the brain is talking to the organs. And so that's what we're seeing in Kelly, is just that right there. Now, also at this level, right out from under the base of the skull, you have 12 cranial nerves that come out loop over C1 and go right back up into the head, those 12 cranial nerves control all your senses. Everything to do with your eyes, your nose, your ears, your mouth. So visual issues, sinuses and allergies, hearing problems, tinnitus, ringing in the ear infections, especially in children. And then, of course, your mouth, taste, the face, making facial expressions, regardless of what those are, swallowing, chewing, mastification, all those things, all your senses is controlled by those 12 cranial nerves. And so right there is a critical area. The first chiropractic adjustment ever given was given to a gentleman named Harvey Lillard, and the founder of our profession, D.D. Palmer, adjusted Mr. Lillard, believed to be in the cervical spine, and the gentleman started regaining his hearing. Harvey Lillard had been deaf for a number of years, and so, some people assumed and thought that they'd discovered the cure for deafness. It wasn't the cure for deafness. What happened was removing the subluxation corrected the decrease of nerve flow, which opened back up the proper channels of function, and it happened to be in the cochlear area of Mr. Lillard, which ended up restoring his hearing. And so that's how chiropractic really got going and got rolling. And so anyway, so Kelly's got just a little pressure there. So now we're going to look at her muscles and see how they're responding to that pressure up there on her atlas, or at her atlas on her brainstem. Okay, so here's Kelly's muscle structure. Again, more white than anything else, which is what we want. We do have a green down here at L3. We've got a yellow at L1. We've got a green at at C5, and then a green and blue at C1. So it's not uncommon at all for people to have nerve pressure and also have muscle activity at the same level, okay? Because again, what controls the muscles? The nerves. And so if there's a problem with the nerve flow, then a lot of times there's either a hypo or hyperactivity of the muscles correlating with that same level. So we've got a little bit of muscle tension there at the base of Kelly's spine. We're seeing a little bit at C5 and C6 are probably, C1 rotates and moves as a single vertebrae more than any other in the spine, but C5 and C6, those two vertebral segments probably endure more movement than any others in the spine, just because we use our head so much, and every time we do anything, yes, no, look, down, anything up here, those segments engage. So we're seeing a little bit of muscle activity right there. Then we drop all the way down to L1, and we see the yellow, which indicates the hypofunction, the low function of the muscle at that area. And then directly across from it at L3, one level down, we see some muscle, some hypertonicity, whereas the yellow is hypotonicity. So a low function and then a little bit of elevated function in the muscle there directly across from it. So that's definitely an asymmetry right there, and there's a little tug of war kind of going on there. Otherwise, what we're seeing in the neck is most likely the very, 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 very beginnings of Kelly's cervical lordosis starting to maybe straighten out, okay, which is what we call forward head posture, which the more and more severe that gets, it will not only affect the neck and the head and how the head is translating on the spine, but it also will affect the low back. And I can honestly say probably 60% or more of people that come in with low back pain, the problem is right up here in their neck. The fact that they have forward head posture, it's affected the spinal curvature in their lumbar spine, causing muscles, their hamstrings, their glutes, and their low back muscles to stay chronically tight. But the problem, their problem, because the pain is down there, is in the lumbar spine. The true problem, in other words, how to correct that, is up top by adjusting the cervical spine and making sure the head is sitting on top of the spine perfectly as well as it possibly can, and therefore that relaxes the muscle structure, and we usually maintain the curves that we want in the spine. So not too bad here on the muscles either. That is probably going to be the lowest scoring test that Kelly has. Now we're going to look at the one that she just had her hand in, the heart rate variability. Okay, not too bad of a scan. So I mentioned we were going to look at the activity, autonomic activity through that vagus nerve, and the balance between the sympathetics and the parasympathetics. Okay, so Kelly's balance is a 98.09. That little white box right there is her, per se. And she's pretty much straddling that black line. So there is no problem whatsoever between her sympathetic output and her parasympathetic output. In other words, those two are nice and balanced. However, on just the autonomic activity in general, she's a 74. So that means there's 26%, okay, of nerve flow, of communication from her brain to her body that unfortunately she's not tapping into. She's kind of out there in la-la land somewhere, okay? And so that decrease in autonomic activity, that decrease in how much your brain is communicating with your vital organs is eventually what leads all of us to that mark of death, okay? As I said earlier in this video, if you're brain dead, there's no communication. There's no nerve signal, no communication whatsoever from your brain to your organs. That's when doctors come in and have to break the unfortunate news to family and usually then start saying, hey, in a humane sense, there's no communication. They're gone. We can keep the other things moving and all that kind of stuff, but when there's no communication from here to the lower body, that's usually when we cease to exist in terms of life and life flow, life energy. Okay, so that's what we're seeing on this scan here. Now, let me point out just a couple of things real quick here and another importance of this scan. If I do this scan, and let's say Kelly's little box would have been way over here, like on the edge of this yellow or in the orange or even on the red or anything like that, and she's in a strong sympathetic response. Well, the sympathetics is what we call fight or flight, okay? When you're in a fight or flight mode, your brain, for whatever reason, is caught up in this idea that there's most likely an imminent danger present. Because that's what it means. When you're in a fight or flight, actually a lot of the blood in your core body is being pulled away, except for just what's absolutely necessary for your survival, and it's being put in your arms and your legs so that you can either fight or flight. Take off. That's why they call it fight or flight. And so when you're caught up in that situation on a daily basis, now, I mean, if you're a police officer, good Lord, in these day and times, firefighter, a soldier in Afghanistan or anywhere, like that where you may have the risk of combat or anything like that, it's likely that it's not going to negatively affect you as badly, because when you're in that fight or flight mode, you have stress hormones, cortisol, epinephrine, adrenaline being created 24/7 almost by your adrenal glands. The excess production of those stress hormones weighs heavily on your body, your nervous system, and ultimately how you function. And so someone who is in that type of situation, in that fight or flight mode, but they're not in a situation like a police officer, firefighter, soldier, something like that, the longer you are caught up in that, the more potentially likely you are to eventually down the road develop autoimmune diseases, okay? Because it hampers, suppresses, it hinders our body's ability from internally to be able to suppress those things from happening. And so the likelihood of all the arthritises, the rheumatoids, the psoriatics, the gouts, the multiple sclerosis, the fibromyalgias, the lupuses, the Sjogren's, cancer, Alzheimer's, all those things that are autoimmune diseases usually proliferate or develop when you're in that high stress, sympathetic dominant, fight or flight, high stress hormone levels there with the cortisol, epinephrine, and adrenaline. And so it's just really nice to be able to do this scan, and I say really nice. I consider myself fortunate to have the technology to be able to do these scans on people on a routine and regular basis in the office and potentially catch something like that the patient has no symptoms of and has yet to show up on blood work, okay? And there's been a number of instances over the last 15 years in my office where I've been doing these scans that exact thing has played out. I've noticed patterns within the scans that just didn't look right and make things highly susceptible to happening. And I've told patients, hey, look, you may want to go back and talk to your general practitioner. Feel free to relay what I'm telling you to them, and just dig a little bit and do further tests. And Like I said, I've had a number of patients to find things way before they had a symptom, way before they felt it in their body, way before it showed up in blood work or anything like that. And we were actually able to take care of it, or they were actually able to take care of it, and we're certainly appreciative of that. So, all right, so now we've looked at all three of those tests. Now the computer takes all three of those tests, combines them together. Okay, first of all, it scores them, and then combines them together, and it gives us what we call your core score, also known as your neurospinal functional index. So this is what I was really saying at the very beginning of this video. If you're not testing, then you're guessing. How do you know the health of your nervous system if you've never had this test? Okay? You can't just assume your nervous system is functioning fine because of either a lack of symptoms or the fact that you feel fine. So many people on a daily and weekly basis are in primary care offices, they're doing annual physicals, they're drawing blood, that kind of stuff, and unfortunately they have to, the doctors or nurses come back in, and unfortunately the patient is given reports of, stage 2 and 3 and everything else of different cancers and things going on in their body, and yet the patient never had a symptom. Okay, never felt terrible or had this going on or that going on that would, make them think that they even had a problem. And so we cannot base our health on simply how we feel. Those sensory nerves I talked about a minute ago, the sensory, the motor, and the autonomic, those sensory nerves only comprise 10% of your total nervous system. 10%. The motor is another 10%. So your muscles and reflexes. The other 80% is your autonomic. That's your organs, glands, and vessels. And that's what's responsible for controlling those. And so we don't want to just base our entire health on 10% of our nervous system or nerve function. So here's the Kelly scores right here. Okay, these three numbers right here. Her first test, that was the nerve test that we did. She had a 94. Okay, she had that little blue bar at C1, which meant she has got pressure on her atlas. Okay, on her muscles, she scored an 82. And I actually said that would probably be the lowest of the three, but it was exactly the same as the one she had her hand in, the heart rate variability. It also was an 82. So actually, and I said, Kelly's never had this done before. She's new with us, but man, it sure is good for me to know that I've got, a superstar employee right off the bat, at least in terms of nerve function and nerve health, because accumulatively, those three scores come up to an 85. Okay, and here in our office, 80 is our gold standard. Okay, right there, because if I draw a little line right over here, everything 80 and above, 80 to 89 is good, 90 to 94 is very good, and then 95 to 100 is excellent. And when you start getting below 80, that's usually when we've got some things going on in the body that need to be addressed, that we address every day in here. And so, but 80 is our gold standard. Okay, Kelly's an 85. So if you're 80 and above in this office, we start you off as a 1 day a week patient, okay? Once a week, once every 7 to 14 days, getting adjusted, getting your nervous system, your spine checked, usually allows you to maintain that level of health for a lifetime, okay? Barring some kind of crazy accident, injury, or trauma or something like that. Then if you're anywhere in the 70s, okay, 70 to 79, you need a little bit more help. We start you off at 2 days a week in this office. And then if you're 69 or below, then usually we have enough significance in change of posture. In other words, you're losing those three curves severely enough to where that alone can create a tremendous amount of pressure on your spinal column and the nerves that exit your spinal column, or your likelihood for an autoimmune issue through the heart rate variability scan is high enough to where we need to get on the stick. We need to do a little bit more help. And so 69 and below, we start those patients off at 3 days a week. Okay, and so that's how we utilize our scan. I've told a lot of people before, this number up here at the top, 85, indicates in all actuality the adaptability right now of Kelly's nervous system. It means that shows how adaptable her nervous system is to the daily physical, chemical, and emotional stress that she experiences on a daily basis within her life. And so that number is showing us that right now she's in a pretty good position. Okay, her nervous system is pretty adaptable. And what I mean by that is just a real quick example, and we're going to finish this video up. And by the way, please share this video. Like I said, this is probably the most important video I've ever done to this point in time, because I'm actually showing you and explaining to you how you can not only take care of your nervous system, but you can have it tested in the first place, okay, to see how well it's functioning, or you know, how well it may not be functioning. But anyway, please share this video as much as you possibly can. Now, the analogy I was going to give you is this. When I'm talking about adaptability, let's say that we all picked up and moved to Alaska. Okay, we're in Alabama. All right, right now it's like 73, 4 outside today, a little drizzly, a little rainy and everything. Not too bad. We've come down from the 80s and stuff. But if we just pick up and move to Alaska, and it's wintertime up there, and within the next month or two, we're dealing with 3, 4, 5 feet of snow and that kind of stuff, we better have some skill sets. If we're living here and we just pick up and go up there, we better have some skill sets, or we better somehow learn how to adapt to that environment real quick. Otherwise, the likelihood of our survivability is going to be very low. So that's the same analogy here. If your nervous system is not healthy enough to adapt to the amount of physical, chemical, and emotional stress that you have in your life on a daily basis, your survivability and your health is declining. Okay, there's no question about that. And so if we can adjust your spine, which we can open up the nerve flow, correct the subluxations, and get you a stronger and better adaptable nervous system to the amount of, because look here, the physical, chemical, and emotional stress isn't going away. Okay, even when people retire, all that stress doesn't just go away. Okay, and because they sit here and tell me that every single day. So the stress is not going to just disappear. So if we can improve how we respond, or how we live on a daily basis within the stress that we have, that's the key. And so that's why I'm always putting hashtag build the host. Do everything you possibly can, whether it's Corona and COVID, through supplements, through getting adjusted, through rest and relaxation, good sleep, good clean water, all that kind of stuff, to help fight those situations. From a function standpoint of view, if you want more vitality, you want to function better, ultimately feel better through your entire body, optimize your nervous system, and that's what we do here. So, guys, I appreciate you watching. Thanks again for watching and sharing. Please share this video. And if you'd like to have your nervous system assessed and measured in our office to see exactly where you fall on the scale and how much care you potentially need, then just give us a call. The number's on the post. That's 256-927-7694. And we'll get you in and get you scanned and healthier and happier starting as soon as absolutely possible. God bless you. We love you, and thank you.